should not be on the list. And delivering children, I agree with. The other things that are on that list I feel would be reasonably moved to the direct supervision category. I think that I'll speak as a urologist in other areas of the country. There are many physician assistants who perform cystoscopy and prostate ultrasonography and biopsy. I believe that these are safe procedures that a physician assistant can handle very easily. I know they're being done in other areas of the country, and I also fear that if we limit our physician assistants and what they can do here in Louisiana, that we're going to lose a lot of them that will lead for other areas where they have more opportunity. I also believe that if our physician assistants are not allowed to do these procedures, then other advanced practice clinicians, such as nurse practitioners, will step in and fill these roles. In many areas, they already have filled these roles, and we have both groups of healthcare providers performing these roles. So I am concerned that we will lose a lot of our physician assistants for leaving for better jobs in other areas of the country. Again, I appreciate the opportunity to speak to the board. I'm happy to answer any questions. If not, thank you very much.
Thank you, Dr. Next speaker is Dr. Charles Williams.
My name is Dr. Charles Williamson. I'm in private practice as an ophthalmologist in Baton Rouge, Louisiana. I practiced medicine in the state of Louisiana for 30 years. We employ 3 physician assistants. One is my daughter, who's been a physician assistant for 10 years. One is my brother, who has been a physician assistant for 12 years. And we're primarily, of course, in the practice of ophthalmology and have approximately 10 MDs, ODs that work for us, 4 offices, 120 employees, a surgery center, and 4 locations. Integral to our practice of medicine is the use of our PAs appropriately, especially in certain emergent situations. And what's most important, of course, in our specialty is proper training of these PAs. In fact, in many medical schools, only maybe 30% of medical students getting out are actually exposed to ophthalmology in general as far as the MDs are concerned. I have a son who's presently an intern at Tulane here and has a residency at Tulane. In this notice of intent, there's 2 parts of this document that concern me. One, of course, is in the notice of intent, which I think everybody's going to find here is the most significant part that most people find problems with, and that's for the board basically inserting itself to become another entity in the supervision decisions according to what PAs may or may not do, and for them actually to then notify us via internet or email and make changes time to time as they see fit. I think that we're going to find that intent, where certainly maybe have some noble intentions in order to prevent some certain problems, especially in the state of Louisiana, where we face incredible health care challenges, 1 million people on Medicaid, lack of funds, stretched medical capabilities, physicians who are extremely busy. I think we're going to find that that's become the more regulation and more insertion that we have in this process, and the more erosion of the supervising physician-physician assistant relationship, the more problems are going to occur not only in the healthcare delivery to millions of our citizens here, but certainly it's going to directly impact negatively the jobs of hundreds of PAs and certainly thousands of physicians. That being said, I think that we'll probably hear a number of specific reasons why that will become a problem here today, so I don't need to go further with that. The other thing that I would like to speak to is under the Title 46 Professional Occupation Standards Act. The only procedure that you list here that is commonly done in our specialty is paracentesis. Paracentesis basically is a procedure in which either a needle or a blade is placed into the eye, into the cornea, in order to reduce intraocular, to let aqueous fluid out to reduce intraocular pressure. As you may or may not be aware, the reason you do paracentesis, the most common reason you do it, is high intraocular pressures. Intraocular pressures can sometimes reach levels of 70 and even 80, especially postoperatively. Some patients with certain types of diseases arrive in an emergent state with high intraocular pressures. These intraocular pressures aren't reduced. They can close off the central retinal artery, which in 5 minutes results in blindness. So, for a patient to arrive in such a state and not having a physician assistant present, and for a physician assistant to not be a supervising physician present within 5 minutes or less, and basically the physician assistant not being allowed to do this procedure, will obviously result in devastating consequences for that patient. So I don't think it's too hard to realize that that probably is a procedure which is unwise to include in this lineup. Thank you for allowing me to speak.
Just a point of clarification, I will mention the provision that was referred to in the first part of your comment was 4507C3, which permits, and I'll read that, subject to board advice and guidance concerning the levels of supervision or services identified in 4507C3 of this part on this website. I take it that's what you were referring to. Just point of clarification for those in the audience, that certainly is not intended by the board to create new procedures that fall within the list of 45073. That's intended and will be applied if these rules are adopted for the board to provide guidance in response to questions that come in with respect to those procedures on its website. So again, it's not designed to change the rules and add new procedures to 4507 to the C3A and B. It's designed to provide guidance on the instances. Okay, thank you very much. Our next speaker is Brett Williamson, PA.
Hi, good morning. Sorry, I'm a bit of a late arrival this morning. Traffic was Dr. Charles Williamson is my supervising physician. Unfortunately, I didn't get to hear the beginning of his statements to you. The things that, in looking at the proposal amendments that concerned us the most were certainly the point he made about paracentesis, for example, the point that the delegation of procedures in the specialties from the physician to their PAs obviously reflects the specialized training of the physician assistant, the complete confidence, of course, of the physician for the PA to perform any procedure that they delegate. Wondering exactly how the board knows how and when certain procedures are performed, and to make opinion, certainly going toward legislation of how these procedures can be delegated in the specific subspecialties. The provision that there may be some ongoing proposals by the board to give ongoing advice